All right. So we're looking at the next complications in the vagina. So this is what is known as a Bartholin's cyst. All right. So in the anatomy for medical students, we'll talk about what is known as the Bartholin's gland. Here we are just trying to talk about all the possible disease conditions that will affect the female gender. So right here on our screen, just imagine that this is a vagina, because of course I can't get a picture of a real vagina because YouTube will tag the content as nudity. YouTube is not only for medical students or women that want to learn about themselves. So let me say, if you have the Bartholin's gland, Bartholin's glands are just glands that are side by side to your vagina. Alright, they are inside though. Now these glands could get enlarged, they could get inflamed, there could be fluid accumulation here. Now that's what they call a cyst. Alright, so it's just a fluid filled swelling that forms near the vaginal opening when the ducts of the Bartholin's glands become blocked. Imagine that this is the vagina too. Okay, I just brought possible questions just to illustrate and all of that. So these glands located on either side of your vaginal entrance produce fluids that help to lubricate your vagina. Alright, so what usually causes these glands to actually become enlarged? It could be that what the duct is blocked. So if the duct is blocked, the duct is supposed to send out things that will basically come to like lubricate your vagina. So if it is blocked, you have a backlog of what fluid in the gland. So sometimes it's infections from bacteria like Escherichia coli, gonorrhea, chlamydia. Sometimes it's trauma or irritation. Injury to the area may also lead to the blockage. So symptoms is what you have: a painless small lump near the vaginal opening. Okay, discomfort while you are walking. So the woman is complaining that when she's walking, when she's sitting, when she's having sex, she's having some discomfort. There's pain or swelling if it is infection. Fever and chills in severe issues. Okay, so diagnosis is just physical examination by a healthcare provider. They can do a lab test if they are suspecting that it's an infection, just to dictate the type of bacteria that is causing the issue. Right? Then they can do biopsy if you want to rule out that okay, this is not a cancer. So treatment options is what? Sit bath. So she can be sitting in warm water to help the small cyst to now burst off, naturally. So if you are dealing with an infection, you have to use what? Antibiotics, right? Then if it is so much, they have to drain it, then sometimes they have to do a surgery to like remove the cyst.